Well, now it's your turn. We're taking your calls for Dr. Zorba Paster.
We have two lines open at 608-608.
270-9933.
I don't know what that number is.
Or whatever that says. All right, let's start with Tom in Middleton. Hi, Tom, go ahead.
Hi, Dr. Paster. I got an Omicron booster shot last week, and my question is how long does it take for my body to build up the immunity? And once it does, can I ditch the mask?
Good question.
Good question.
Good question. Well, generally, I think when you get that, about 2 weeks later, your immunity really is pretty good. You know, within 2 weeks. You've got a 2-week period, probably at 1 week, certainly at 2 weeks. And then you certainly could ditch the mask, unless it's appropriate to wear a mask. Now, we were at American Players Theater just the other day, indoors, one of the indoor sessions, and there everyone was required to wear a mask because the actors did not want to get COVID. So it wasn't just for us, it was for the actors.
Okay.
All right.
All right, very good. Let's go to Todd in Monticello. Hi, Todd. What's your question?
Well, I had my initial 2 shots, the year ago, and then 21 days later, then I got my booster, then I got my second booster. Do I have to wait to get this shot?
Not at all.
Like all the other ones?
When did you get the last booster?
Yeah, it depends. 2 months after the last booster is when you can get the next booster.
Unless you have
other things. And once
unless
again,
you had COVID,
that's right. Unless you have COVID, in which case you've got, 45 days. So.
All right, thanks.
You're welcome.
Thank you for calling.
Let's go to Alan now in the town of Burke. Hi, Alan.
Hi, doctor. I was trying to get my booster shot when I got my flu shot at my doctor's last week, and EW said they're not available yet. Where did you get yours?
Oh, they're available. They're at the pharmacies. Mine was at Walgreens. So they may not have had it at the UW because they didn't have that supply, but go to Walgreens, CVS, they're available there. And a number of independent pharmacies also have the shot.
And I think the UW has it now.
Yeah, we're being told they have it now, so check back and see. They got it. They just got them this week.
Well, Mike was on line 1. We lost him, so he wanted to know how long the shots are going to last.
That's a good question, isn't it? That's right. The reality is we get the booster. We don't know. Once again, we're still learning a lot about COVID. As much as we know, there's still more to learn about it. But the reality is we do know the shots make a big difference. They reduce the risk of hospitalization tremendously and death tremendously. So, and there's still people who never had their primary series because either they were against having immunizations, they were the anti-immunization people, or simply they were lazy. I mean, that's what I say, or, they just haven't had the time to do it.
All right, let's go to Cindy in Fitchburg. Hi, Cindy.
Hi there.
Hi, what's your question?
I have a question regarding getting both vaccines, the flu shot and the COVID shot at the same time. About 4 years ago, I got a flu shot, and I had a bad reaction to it. So if I got both at the same time and had a reaction, how would I know which one I'm reacting to?
Oh, you're right. Very good point. I think if you've had a reaction to the flu shot, your answer is get the flu shot one time, get the COVID shot another time, because you'd like to know whether or not you're going to have a reaction. And just because you had a reaction to a previous flu shot does not mean you're going to get one to the present flu shot.
Okay.
And they're thinking it might be a bad flu season.
Yes, they are. And it might be, it's certainly going to be worse than it has before, because the reality is we've all been masking up, and so influenza has not been as bad as it has been in the past.
Okay. All right, let's go to David in Madison. Hi, David. What's your question?
Yes, I have a question regarding wearing a mask. I drive to a facility, I put my mask on, I come out, I put my mask in the visor, I go to the next facility, I put my mask on, come back out, and I keep doing that with the same mask. So is that a problem?
I don't think so. I think we now know that generally you can wear the same mask over and over again. You want the mask to be a good mask, either a surgical mask or an N95 mask. We do know that cloth masks really do not do that much.
We've learned a lot along the way.
We have definitely
calling.
learned a lot, and it's going to make a difference in the future.
All right.
Do we have another call?
Not right now. There's nothing cleared, so.
Okay. A lot of people, Zorba, are waiting until we get further in the winter or closer to the holidays to get the new COVID booster. Do you think people should wait, or should they just seize the day and get it now if they're eligible?
Well, I seized the day. In other words, Penny and I got ours right away, and the answer is because who knows when the next variant is going to come by. We don't really know, and I think the answer is do it sooner versus later, and also if you wait too long, it may be harder to actually get an appointment to get the vaccine because I have no idea how long that vaccine is going to be available until they run out of vaccine.
And if there's another variant, there's not going to be a vaccine soon enough to,
right. That is
counteract
exactly
that.
Right. So my recommendation is getting the shot now. I think makes sense for almost all of us.
Was it easy to get an appointment? Were there a lot of appointments
No problems
available?
getting an appointment at all. No problem.
And the
Good to hear.
Moderna versus Pfizer, can you switch?
Doesn't make, you can mix and match.
Does it help?
Mix and match.
Should you switch?
I think it's better to get one of each kind. I think if you got Pfizer, Moderna is better. Moderna, Pfizer is better just because you may get a little bit more robustness.
Really?
I'm in that school.
All right.
All right. I'm an Android guy, but switch. Zorba, thank you.
Thanks, Zorba. Great
Thank
to
you all
see
for
you.
calling in.